How do you interpret a semen analysis? I'm Dr. Moayeri, owner and founder of OC Fertility. If you're trying to get pregnant, it's important to get a semen analysis because male factor infertility affects up to 40% of couples. When you're evaluating a semen analysis, you want to make sure that there's at least 1.5 milliliters in the ejaculate, otherwise you might be worried about a blockage. The other thing we look at is concentration. Typically you want to see at least 15 million per ml of sperm. Less than that might compromise natural fertility. In addition, you want to see at least 40 to 50% of motile sperm moving forward. Now, there's forward progression and speed of progression, but generally you want to see about 40 to 50% moving well. The last thing we look at is morphology. Morphology is a little more tricky to interpret, so it's interesting to note that we don't expect a lot of the sperm to be normally shaped in order for people to get pregnant. When you see less than that, you might want to consider factors of lifestyle or age that can also affect the shape of the sperm. So when we're taking this in a total evaluation, you might not have all the parameters normal, but there's a particular evaluation called total motile count that takes into account whether the number of sperm moving well exceeds 10 million, and that generally gives us an idea of how normal the semen analysis is. So you might have fewer sperm but a high motility, or you might have a lot of sperm and maybe a little bit of a lower motility, and having a total motile count gives you an overall picture of a man's potential for fertility. We generally want to see a total motile count of at least 10 to 20 million to determine a normal semen analysis. Sometimes people ask, well, what causes abnormalities in different sections of the semen analysis? So, the volume we had briefly mentioned, if it's low, you might worry about blockage. It could be from infection, or perhaps there's retrograde ejaculation maybe into the bladder. There could also be issues with the count, and that could be from either a production problem or maybe lifestyle issues. And then there could also be issues with movement, the motility, and that also can be related to lifestyle as well. So if you get these results and you find that anything's abnormal on these test results and you're trying to conceive, you definitely want to seek attention from your primary care doctor to start with, but then eventually it probably makes sense to see a urologist or a reproductive endocrinologist to see what your options are.